Hello, this is Yehoshaphat Oliver on the 19th of April 2020, the 25th of Nisan. We discussed how people are separating out into two different groups. On the one hand, you have those who believe in the official story of COVID-19 and want to enforce their belief on everyone else. So they're COVID-19 believers. And then you have those who are very skeptical and critical of the official story. And these two groups are separating out into very separate camps, to the extent that they share, in a way, they share so little in this extreme time. They fundamentally disagree about what social norms should be followed and how to view these events that are causing such upheaval in our lives. So now, how does all this apply to the Orthodox Jewish community? Well, right now, it doesn't apply as much because we're all basically limited by the fact that we're stuck in our houses and we're not going to synagogue, and the synagogues are anyway not open. So there are some people holding private minyanim, which is a prayer quorum, but that is limited at this point. The issue is when the lockdowns are removed and the official restrictions are loosened, the question is just how much will they be loosened? And the question is also, even when the official restrictions are loosened, they won't be removed completely. You can bet that. How much further will the powers that be in the Orthodox Jewish community go above and beyond the official restrictions? So I'm not advocating here that everyone should ignore the restrictions. What I am advocating is that we shouldn't go above and beyond the restrictions. So if an outdoor gathering of 10 people is allowed, we shouldn't forbid outdoor gatherings of 10 people, for example. And many rabbis have done that in many places based on what they say that experts told them. On the other hand, other rabbis have said that there's no need to go further than what the government is forbidding. So I'm going to read out some lines from an email that I got, which discusses the reopening of synagogues, of services, of public gatherings in the Orthodox community. And I think this is a sign of things to come for us and in various manifestations for everyone in terms of the control that we will be subjected to, all in the name of submitting to medical authority and government authority, government power, all based on the flawed presumption that we can trust the government, that we're getting accurate information from the government, and that we should, from the top down, impose rules and prohibitions on members of the community according to some advice, supposedly, that leaders of the community got. And I want to say that there's a fundamental difference between a rabbi who's acting as a sort of scholarly leader and an administrator. An administrator has a different perspective. His perspective is not necessarily what is allowed according to Jewish law or forbidden according to Jewish law. His perspective is based on his considerations as an administrator. So he will impose things or forbid things according to his own considerations. And unfortunately, I think that it is not appropriate for these administrators to dictate to rabbis what should be done in the name of health. I also don't think really that the rabbis should be doing that. And I can see a certain argument for a rabbi laying down the rules in his own synagogue. But in terms of the behavior of the community outside the synagogue, and we're dealing here with matters in which there is wild extreme opinion and of conflicting reports on these issues, let each individual decide for themselves, especially when it comes to establishing breakaway prayer groups. Okay, so I'll read out some lines from this email. So this email is entitled Committee to Safely Reopen Minyan Gatherings for Prayer. Although there is no question that we need our minyanim back, our tefillah b'tzibur, our prayer in the community, our ability to care our loved ones, we, the undersigned, realize dangers to life involved in such an endeavor. Any exit strategy to reopen the minyanim must be planned and implemented with the highest regard to all of the above as medical opinion. One additional hurdle that we face, even if only some minyanim reopen safely, is that it will cause an avalanche of non-safe minyanim to open as well, causing more deaths, causing further spread of the disease, and causing more conflict. At this point, the undersigned rabbis, doctors, and organizations strongly feel there is not enough information medically known to allow a safe reopening or even a partial reopening of minyanim. Some factors that are yet unknown are if there is indeed immunity, if one had it already, how long its immunity lasts, and if it exists, how accurate the testing for COVID-19 is. Any plan to allow even a partial reopening of some minyanim in neighborhoods must include all the following criteria. A plan for careful pre-screening of people who have been medically certified by a pre-approved group of doctors to have been effectively immunized or to have active and effective antibodies to COVID-19 and not be possibly contagious. A plan for safe social distancing of 9 feet and the wearing of N95 masks. Signs to be posted at the minyan, meaning in the synagogue, which clearly state this is a medically approved and legal gathering. Inclusion in a list of approved minyanim that is posted on the Jewish media sites. No other minyan or shul should be sanctioned by the rabbis and doctors of the community. Should an effective vaccine be developed, or if the state declares that the pandemic danger has passed, the shuls and minyanim should be allowed to reopen. It is understood that an effective vaccine may be 12 months away or more. All right, so the presumption here is that the entire community has to conform to these edicts, and without that, you can't open up a minyan. So I view this as really problematic. Essentially, what this means is that these people will be preventing the opening of synagogues and even of prayer gatherings in people's private houses, even when it's allowed by the government, um, because they're not approved. So they'll only allow the approved ones, not the non-approved ones. And what's most ominous here is the saying that if there'll be a vaccine, then the synagogues will be allowed to reopen. Well, what does that imply? That implies that only those who have the vaccine will be allowed to go to synagogues. You need some kind of certificate to prove that you got the vaccine. Of course, that's what Bill Gates wants, a certificate, even in your body. But be that as it may, you'll have to show proof that you got the vaccine in order to go into the synagogue. That's where this is leading. You'll also need proof that you were tested and shown to be non-asymptomatic, and so on. Well, before you can go into a synagogue. So, and anyone who doesn't conform to these expectations is not allowed to open up their own breakaway minyan, because that would be unsafe. So this is all operating from the flawed paradigm that we must obey the government, and in fact go even further than what the government tells us, because we accept the paradigm of lockdowns, the paradigm of social distancing, the paradigm of this disease being so very contagious and so very much more deadly than other diseases. Now, one can make an argument that that's the case in New York. I won't get into that now. I've gone into that in another video. However, in all these other places, such as Melbourne, Australia, right here where I live in Houston, various other places where geographically there's no massive increase in deaths compared to the yearly flu. In fact, the death rate is much lower than that of the yearly flu. To impose all these restrictions and to outlaw all other prayer gatherings unless you have your certification, and to persecute anyone who opens up their own separate minyanim, their separate private prayer gatherings, this is really draconian. And I say, well, certainly you should not get the vaccine. If getting the vaccine means is the only way to go to synagogue, then you should not go to synagogue. If the only way to go to synagogue is to be tested, you should not be tested. No one should take these tests because, firstly, you could get a false positive. Number two, there's strong argument that they are gathering your DNA through these tests. And also the test itself, many say, could contain coronavirus. And in general, a healthy person doesn't need to prove anything to anyone. If there are people who are concerned for their health, they think they have a weak immune system, they have a compromised immune system, well, then that's on them. They should not come to the synagogue. We shouldn't be imposing on the entire community any restrictions uh, long term because of the possibility that someone could get sick. Now, that's not to say that we're not concerned about that, but the situation is in reality no different from what it was last year and in all of time, which is that diseases go around and some people are affected by them. The best way to deal with them is to improve your health, is to get exercise, eat healthy, and there's no need to impose these measures. So they want to get signatures of rabbis and community leaders and doctors who all agree to these committee to safely reopen minyanim, in other words, to safely reopen synagogues, which would ban any prayer gatherings that don't conform to these strictures. So I say, don't cooperate. Don't cooperate. If it means not going to synagogue, not going to shul, don't go. And don't be afraid to open up your own private prayer gathering, and don't conform to this paradigm that is based on lies, is proven false. If anything, these rabbis and these community leaders should be retracting everything they said now that the projections of the doomsayers were proven false. They predicted that 2 million people would die in America and 500,000 people in the United Kingdom and so on and so forth. At the end of the day, on average, the COVID-19 has been as deadly as the yearly flu, if not less so, maybe slightly more so, certainly not to some kind of far greater order of magnitude than the yearly flu. That is now turning out to be the undisputed reality. But these leaders want to continue to operate under this utterly debunked notion that COVID-19 is so very deadly, and therefore every single measure has to be imposed in order to, reduce the danger. It also implies a certain lack of faith that even when the government removes the restrictions, we're still imposing restrictions. We know that the government, the direction it's going in is that this will be used against us. This will be held over our head for a very long time. Fauci has spoken about getting a yearly COVID-19 vaccine, and that yearly vaccine will be mandated. And so we're talking about an incredible intrusion into our private lives. And those who are concerned for their health, they can stay home. If they want to keep a distance, they can come to the synagogue, the shul, and sit at a distance from other people. I don't know, if they want to wear masks, no one's stopping them. But people should not be required to wear masks. We should be talking about the paradigm of promoting herd immunity, which is specifically when people are able to get the disease. when the disease spreads and people therefore become immune by getting the disease. That is the most logical and effective way of combating the disease, which is essentially to do nothing, essentially to pretend it doesn't exist. And whoever is affected by it will be affected. They will either receive treatment that is effective or not receive treatment that is effective. And it's also extremely important that there are effective treatments, in particular hydroxychloroquine and other treatments, which remove the need for drastic measures, because if you catch it, you might die. Well, you might die, but if there's a treatment, there's a good chance you'll recover. So, therefore, that's an additional reason that all these rabbis and lay leaders and doctors should be retracting their statements so far, limiting people's freedoms, and we should just go back to normal. Aside from the fact that people can make the private choice to wear face masks or gloves or sit at a distance from other people, they're entitled to have the freedom to do that. I have no problem with that. I think that's excessive. If you didn't do it last year, you shouldn't do it this year. If you're not well, last year you didn't avoid going to the synagogue because someone might have a disease and it might spread to you. You didn't do that. So don't do it now, and don't do it in the future. But if you want to, you're entitled to do that. But it's not appropriate to restrict everyone else simply because you're so attached to the paradigm that we've been told by the government authority figures and the medical establishment. And therefore you insist on imposing that on everyone and threatening them that if they don't, they'll be ostracized from the community. They won't be able to come to the synagogue. They won't be able to share in public events. Well, I say that if it comes to that point, that the administrators and whoever wants to exclude people from coming to the synagogue if they don't have their haven't done their tests and haven't had the vaccine, well, people should rise up, should reject that, and they should establish their own breakaway minyan prayer groups and not cooperate, not comply with these restrictions that come from people who, I don't know, they're not really in a position. Their entire sort of mindset is based on conforming with authority. They're not the kind of people who think independently, who are open to speaking out against the government or against medical authority. Their sort of MO is conformity with authority. And because they're weak that way, they're going to impose their weakness and their inclination to conform with this false paradigm, the official government narrative, on everyone forever. No. We should rebel against this. Those who want to, you know what, if there are people who want to have established minyanim with those restrictions, Well, that's also a bit of a problem. You shouldn't exclude anyone from your minyan. It's never okay to exclude someone from a minyan, especially someone who's perfectly healthy. But you know what? At least let them not, come out banning and ostracizing and shaming those who choose to establish their own breakaway or separate gatherings. Let them live and let live. If they want to follow this, what I believe to be paranoid, excessive, um, ridiculous, over the top standard of social distancing and gloves and face masks, and they want to live like that for the rest of their lives, well, they can do that in their own territory, and let everyone else have the freedom to make their own choices about their own health. And as to what you say, that some people are endangering other people, I don't agree with that. But the people who think they're in danger, if they're so weak, if they're so very susceptible and vulnerable, let them stay home, or let them set up their own separate minyanim where other like-minded people will gather. God bless. I should hear good news. Thanks for listening.